we are so fortunate that our hospital partner has continued to allow the students in there. We never had 1 week that the students weren't allowed in the facility. When we lost, some of our other rotations in the community, they opened up the clinics to allow our students there. So even though it's been some unique experiences of finding alternative, clinical hours, Dignity has been a great partner in making sure that our nurses are still getting the education they need. It started off as a collaboration with, of course, public health, the county public health, and we're using their system to make the reservations and to record all the vaccinations. And then, of course, UC Merced had I guess they call it a tray of vaccines that they had, and then Dignity Health had 2 trays of vaccines. And both UC Merced, we have a nurse that is volunteering their time this last 2 days, and Dignity Health or Mercy Merced has sent nurses every single day that we've run. I think we have 4 of the hospital nurses here today.
Oh, it's giving me a whole lot of opportunity because there's many, everybody's suffering, and then with patients, even at the hospital and even here, you hear their stories, and sometimes it's really sad, and it's a really good opportunity to kind of interact with them and make sure that they're, okay. The challenging part as a student is we actually have a lot of things that's closed for us as a student. When we first started, the pandemic hit, so we weren't able to get the full experience of the nursing experience that we really want, but it has affected. But actually we improvise a lot. So we've actually, gone to the hospital, take care of still patients, and, coming here to give the vaccine to, the community. I think it's a really, it's really touching that we can be a part of it.
I feel like we've gotten, even though it's not the clinical experiences we want that you would usually get, I'm just kind of happy that we're even getting clinical experience in the first place. So it's giving us opportunity to just be with patients. And I know right now there's all these rules of, you can't really have family there. And I feel like even though we're not their family, we kind of can be that extra person to talk to when you're pretty much in the hospital by yourself. It's been a lot different than I thought it was going to be before I signed up, because we obviously have condensed to be safe, so we're having Zoom classes. We're, trying to keep a minimum of students if we do have lab, or, we're only allowed in certain floors for clinicals. So it's definitely changed a lot of stuff, but I'm just grateful that we even have the opportunity to still go to school, and we kind of have to be flexible in the process, but I'm just happy that we can still do it.
Seeing the effects of everything that's been going on, not only on the patient, but on the doctors, on the nurses, it's been really hard on everybody. So I think being there to give an extra helping hand has been something that I've really enjoyed doing too. Like they said, we haven't been able to go to as many floors, but the floors that we have been able to go to, we kind of get a good picture of how it is to be a patient without family members there, and how the team works together to take care of that patient, COVID or non-COVID. It's been real eye-opening. I feel really honored to be doing it because the vaccines are something that we've been waiting for a year now for, and something that it's kind of like the light at the end of the tunnel for this all to be over, and to be able to be giving that out to everybody has been really awesome. I feel like I'm part of history in a way. It's been hard seeing patients without family members and having no way to really have them by their side, and just being lonely, and it's hard because you can't sit with every single patient and be that person for them. So you got to kind of like ration out your time with each patient and kind of be that shoulder to lean on with everybody. So that's been hard, and it's been hard. I think everybody on mentally, it's been hard on everybody. So we're seeing the effects of that. It's been a hard year, and we're ready for it to be over.